So does your doctor order more tests just to see how your insurance is going to react? Hey, this is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video for you today. And we have routinely patients who come in who say they've had a variety of tests performed, and they're like, I don't know why I had this test performed. Sometimes patients have tests performed because their physician they're seeing, the clinic they're seeing, and I'm saying more unnecessary tests here, because their physicians are not conservative minded. Other times it has nothing to do with that. Sometimes it has to do with the clinic director or the person who actually owns the business. It's a business decision to make money. Businesses and entities do not love you. Physicians do. Many physicians and nurses do. But some of the clinics are not actually operating out of your own best patient care interest or true patient health care, but out of a business interest. That's why it's important for you to try and find providers that are conservative minded. That's number one, a good thing to do. But you also want to find those who will actually listen to you, and you need to be an advocate for your own health and not just allow any test under the sun to be done to you. I can show you an example of a patient that went in routinely locally and then was sent to another city in Lincoln or Omaha to have additional tests. The exact same tests were done every single year for 3 years in a row. And eventually the patient said, why am I having these tests done at both these clinics, every single year? And their provider said, well, it's just protocol. Medicare will pay for it. Well, that's not acceptable. That's not acceptable to put somebody through that. You need to find somebody who's not just trying to do tests just because Medicare will pay for it, but things that are necessary tests. So you need to be involved in your care. You also need to not just allow any test under the sun to be performed on you. You need to be conservative minded and need to find conservative minded providers who are willing to work with you and allow you to ask questions and play an active role in your care. So that's my suggestion to you today. Like I said, the majority of providers, they're not bad people at all. Sometimes they do have somebody on up in the upper echelons of management that are promoting some of the care decisions as well. And you just need to be savvy of those things, be a wise as a serpent, so to speak, but be actively involved in your care and in your family's care. Try to find one thing you can do for yourself today to get yourself healthier. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.